There's a wave of controversy this morning, and it's growing over new guidelines from the American Cancer Society. They recommend most women start mammograms at an older age. In a New York Times op-ed today, 3 leading doctors are now pushing back. They say they profoundly disagree with these changes. Michelle Miller's here to look at the divisions in the medical community. Michelle, good morning.
Good morning. Well, the American Cancer Society says it came up with the recommendations after reviewing the best medical evidence available and weighing the benefits and harms of mammograms. But with more than 200,000 new cases of breast cancer expected this year, the doctors who wrote the editorial say early detection is key.
If your #1 goal is reducing the deaths related to breast cancer, then mammography starting at age 40 makes sense.
As top specialists in the battle against breast cancer, Doctors Elisa Port, Susan Drossman, and Emily Sonnenblick say they can't back the American Cancer Society's latest screening guidelines. What don't you agree with?
The problem with these guidelines is that they're confusing to the very women that should benefit from mammography.
They publicly aired their concerns in this morning's New York Times, saying, "We were happy to support the Cancer Society. Now we no longer wish to be involved." The new recommendation suggests women with an average risk start yearly mammograms at age 45 instead of 40. At 55, they can switch to every 2 years. But the ACS adds women can start screening at age 40 if they wish.
Our goal is to empower people to make that informed decision.
Dr. Kevin Effinger chaired the independent panel that created the new guidelines.
As a woman ages, the breast tissue tends to get less dense and makes reading easier.
I've had the privilege of finding early cancers by screening women in their 40s, and these guidelines are a setback in protecting the health of these women.
Critics worry the changes could lead insurance companies to limit coverage.
The question is, will we be covered to be screened? Will insurance companies jump on these guidelines and then say, sorry, no reimbursement?
The American Cancer Society continues to be one of the strongest voices for continuing insurance for women age 40 and older.
So why push it back to 45 from 40 if, in fact, you've left the door open for it to be insured?
At 45, there is no question by both how common breast cancer is, the ability to mammography to help save lives. Between 40 and 44, breast cancer is less common.
In the hundreds of responses the op-ed received online, there was strong reaction on both sides. One reader wrote, "What if the one saved woman is you? 8 years ago, it was me, or your sister, or your daughter, still willing to play the odds?" Another said, "Personal experiences of the few should not drive medical policies for the majority."
We desperately need resources for better technologies.
Top oncologist and CBS This Morning medical contributor Dr. David Agus says the focus should not be on when to get a mammogram, but how to better detect breast cancer.
We want to be told what to do, but there isn't enough data now to tell every woman in the country what to do between the ages of 40 and 45. So that decision is between the woman, her family, and her doctor to make the right decision for them.
Adding to all the confusion, yet another new study is raising questions about the value of mammograms. Now, the report in the New England Journal of Medicine found that despite women getting mammograms for decades, the testing hasn't cut the rate of detecting advanced breast cancer. So I'm sure there's going to be a lot of talk about this new study as well.
Is there any reason, what's the explanation as to why?
Why
it hasn't detected, there has not been a decrease in detecting with all those mammograms?
Well, it's an issue of whether or not women are going and whether or not they are going and getting it early enough.
So I think women have to do their own due diligence, find a doctor they trust, and make their own decision. It's so, more confused. Thank you, Michelle.
Dr. Michelle, thank you.
Thank you very much.